Well, believe it or not, Brits can now add Viagra to their supermarket shopping list. The popular impotence drug is available cut price and over-the-counter from English high street supermarket Tesco.
And no doctor's prescription is needed to buy the little blue pills, and staff have received training on how to handle all requests diplomatically. So, is self-diagnosis a blessing in disguise or every GP's nightmare? Dr. Cindy Pan here to run us through some of this. This move seems to put Viagra on the same level as, say, aspirin. Is this a good idea, Cindy?
Well, I suppose the thing is, even aspirin, there are potential hazards in just taking that willy-nilly. And with this, even though they don't need a prescription from the doctor, it will be sold from the pharmacy within the supermarket, and there will be some testing, like a questionnaire and blood pressure, diabetes and cholesterol test. So it's probably not as good as actually seeing a doctor, but it's better than buying it off the net.
Okay, well, I was going to say, what are the problems, say, with buying it over the internet that you're going to be solved by getting it at the supermarket pharmacy?
Well, the issues with getting it on the net are, first of all, you're not having any kind of health assessment by any kind of health professional, and also a lot of the drugs that you get over the net might be counterfeit or fake, and that'd be one thing if it was just plain old sugar pills. At least it's not going to do any harm. But some of the ones over the net, they're actually contain active drugs at much higher dose. So it's actually quite dangerous. And also there can be contamination with lead and mercury. So, yeah, buying it over the net is definitely unsafe and has even less health checks. So, yeah.
Much happier talking to you on the show about this, because it means that I can ask questions and sound like I'm just communicating to our audience. What are some of the benefits? No, let me ask you this. Well, are there any side effects to Viagra? Just because there are people watching who'd want to know, Cindy?
Yeah, no, there are definitely side effects. The common things are things like flushing and headaches, nasal stuffiness, but it can be more serious things like blood pressure changes and heart attacks. Some of the unusual ones are visual changes. Sometimes there's a blue tinge to your vision, or just changes in the way you perceive colours like blue and green. And the thing is that obviously if you're taking higher doses than you realise because you're buying these fake ones on the net, then you can have much greater, more serious side effects. So,
okay,
that's more serious.
Okay, so there's some of the bad things, but let's talk about the good things with able to have better access to Viagra. This kind of gets over some of the embarrassment, I guess, that maybe some guys have about going to the doctors to get the script.
Yeah, well, I think that, you know, there's a lot of stigma and taboo about a lot of sexual issues when that's really kind of unhelpful. So I think bringing it out in the open and treating it like it's something kind of every day, I think that's a benefit. And I think it's important to recognise that pharmacists have a really important role in healthcare, and there's a lot more to it than just dispensing and ringing up on the till. I mean, pharmacists actually can help a lot, but I think what's ideal is to have that relationship between the GP or the doctor and the pharmacist and the patient, to have a real collaboration and work as a team. And I think it is still more ideal if patients take the problem initially to the doctor and actually have a full health assessment and physical examination, and then
just get the backup ones, the repeat prescription from the pharmacy.
Exactly.
From the supermarket.
Yeah.
Okay.
So working as a team is really good.
All right, Cindy, thank you very much for that.
It's a pleasure.
Good to get through all those questions, Carl.
Yeah.